the Venture Center of Excellence was created by EIT Health and EAF. What is EIT Health? I still need a few slides, a couple of slides to introduce our organization because maybe not everyone has heard about it yet. EIT Health is a pan-European organization. So here you can see our offices where we are present. I won't go into details, but want to highlight a few partners. So if you look into our partnership, we have 50 core partner, 100 associate partner, and a couple more network partners. And among those, we have 6 out of the top 10 global leaders in pharma, medtech, and also digital health, as we are at the Digital Health Summit. We have top accelerators in every area in our network. We have all the top 5 and almost 50% of the top 25 universities in the Reuters most innovative universities ranking. And of course, we have a couple of great universities, actually also 50% in the Times Higher Education ranking. And on top of that, including Klinikum Rechts der Isar at TU Munich, we have many of the European large and top university hospitals covering or treating 58 million patients a year, of course, leading to a lot of many euros of turnover in addition to that. But talking about euros, also our investment network is rather strong right now, but we are increasing on that, and you will see in a second how we will do that. So EIT Health, that large organization, teamed up with EIF, the European Investment Fund. On the one hand, we have the European institution funded by Horizon Europe in the future, still funded by Horizon 2020. So that's the European Commission's research pillar. We are supporting 600 startups that we have in our portfolio right now. Our startups have attracted almost €250 million, 248 million euro in the first years of existence from 2016 to 2019. This year it got a bit more, so that's, I find, already quite impressive. But EIF has even more impressive numbers. So if you look into that institution, and also not everyone will know that, of course, the professional investors, the VCs, know EIF, but not every startup maybe. So what's EIF? That's an institution that was created 25 years ago, and they have committed investments through the European Union, through the money of the European Commission, of 2.5 billion euro since inception. And in the life science area alone, they award and provide 300 million euro in total right now. They have 40 active relationships to venture capitalists and their general partners in a whole European coverage, and have invested, or through the VCs, have invested into 1,200 ventures. So that's, and 500 of them are active. So they are, I have to admit, a bit stronger and a bit larger than EIT Health, but that's exactly the reason why the two of us thought that we should join. Going back to EIT Health, what do we offer to startups? We have 3 lines in general: innovation, education, and business creation. Business creation is the area that I lead as a director. There we support startups from very early stage, from their ideation phase, postdocs coming out of university and having their first ideas, looking for someone helping them to shape their business plan, till the scale up and scale out phases where companies have already raised the first million, the first 10 million, the first 50 million euro. We have even companies that have raised already 80 million euro in our portfolio. And all of them are supported through those 3 lines: incubate, scale up, and scale out. But along the line, you always have to validate your ideas. You have to validate your very first idea if there is actually a medical need, but you also have to validate if you want to expand to another market, if there is also a market need in, let's say, China or Brazil, if there is regulatory hurdles, and if there's also a reimbursement pathway for your product. To sum up, in the EIT Health Accelerator, we mainly provide access. We provide access to knowledge through programs like our mentoring and coaching network or our boot camps. We provide access to markets through our Bridgehead program or through our Gold Track program. So that's kind of soft landing activities where we also flip it a bit around. Usually startups apply for for clusters, incubators, and accelerators. And in the Bridge Lab program, we give 30 to 50,000 euro to startups that we select up front. And then the accelerators and incubators in the target countries have to apply for the startups. So they pitch to get the top startups. Actually, a very nice approach, and it works very well. We provide access to stakeholders. So the partners that I have mentioned before, all the large industry providers like Siemens, Roche, Sanofi, but also all the top universities and their university hospitals, including TU Munich and the Klinikum Rechts der Isar. They are part of our network, and we provide an entry to them through our EIT Health Catapult and alumni network, for example. And last but not least, we help you getting access to investors and to funding. So what's the idea of the Venture Center of Excellence, this brand new thing that I just briefly mentioned? We thought, and actually also EIF asked us, if we somehow could find a way how to focus our corporate investors a bit more on European startups. You all might know that all the big corporates like the Siemens, Philips, GE, Roche, Sanofi, they have their investment arms, their VC, their corporate VC divisions. And they usually invest in non-European startups. So they very often invest in American startups, US startups, or others. And we thought it would be really good if we could trigger a few more European investments. And that's also something that EIF wanted to do. And by joining forces, by providing additional funding whenever we see a co-investment between a European corporate investor and a private VC, then we would put some money on top to make it also attractive for the corporate VCs to invest in European companies. In order to do so, we focus on three elements: therapeutics, that's the pharma area, that's not so interesting today, medtech, that's getting a bit more interesting, and digital health. So digital health is one of the three key areas where the VCOE will channel his investments in, or its investments in. We started with 150 million euro that we got from the European Commission as a backing. So that's kind of the corner or anchor investment that's coming from the European Commission. And then we select 15 to 20 of the leading venture capital firms and investors in Europe. So the EIF is an anchor investor in almost all of them, and they have defined the gold standard how to define the best VCs. So we want to take the top VCs in the life science area, also including digital health, into that approach. And then we take our corporate VCs, but it might be also like insurance companies that since this year will be allowed to also invest into startups into that approach. And for them, it's not just the money, it's also the innovation capacity that is strengthened, their access to deal flow via the co-investments we trigger. So the idea is we get the corporates, we get the VCs in a co-investment. Of course, they always can invest also directly, but the idea is to trigger those co-investments. And that's supported by a platform that we provide. On the one hand, of course, we want to create a partnership between those investors. They should know each other, they should trust each other, they should look into their common deal flows. But we will also support that through an artificial intelligence instrument, through Scopy, that is scouting into the deal flow and proposing potential consortia that then and syndicates that then can invest together. And in times where it's harder to meet in person, that certainly will be of greatest help. And the deal flow in general, so we our partners, the corporate VCs, the private VCs, the EIF deal flow, our own deal flow, that sums up to around 5,000 startups that we would look deeper into. And then in the end, that comes down to 150 to 200 portfolio companies that we want to invest into through that instrument. And I brought a few examples why it really makes sense. Very often you identify amazing startups only at a local base, and then you bring it into consortia. You have to build consortia to invest together. It's just too much for an individual investor. And therefore you start creating syndicates that invest together. The range of investments that we want to see here is between 15 and 65 million euro. per investment for all the co-investors together. So we really want to make sure that a great company doesn't have to go to the S. You might say now that in digital health, investments usually are a bit lower. That's right. So compared to therapeutics, the numbers in the same set of series are lower, but also digital health companies get into an area where large investments will be needed. Here's another example where you can see that one of the Munich investors, Wellington Partners, also teams up to co-invest with others and then look for a great exit. So that community management element, that's something that we as a community, as a pan-European community, involving corporates, involving also universities and university hospitals, and putting them in touch with startups is exactly the right way to do. So that's, in a nutshell, that's the partners that we bring together. I was talking a lot about, of course, EIT Health and the EIF. I was briefly talking about the corporates and their VC arms. I also mentioned, of course, the venture capitalists. Of course, I talked about the startups. Many of the startups, the potential startups that we want to attract into that instrument are present also tonight. And something that we discovered quite recently is that we also want to involve health insurers. So health insurers have a potential to also invest into new startups. At least in Germany, that is now possible. And we thought it might be a smart idea to also involve them as strategic investors alongside the corporate VCs. So how do we do that? We scout through that AI platform, through the 5,000 companies that we have in our portfolios. And if you, as a startup, want to get into that, just let us know. There is multiple ways to get into the EIT Health platforms. And once we have you there, we will track you, we will screen you. And once you're ready, once you have a round, that doesn't make sense for a 500,000 euro pre-seed round. It also doesn't make sense for a 3 million euro small series A. But if you get in that range of 15 million euro, maybe also in digital health a bit lower. We are fully aware that digital health has low rounds. So we might take also smaller tickets there. It certainly should be something where it makes sense to syndicate cross borders in a pan-European syndication. And that will be exclusive to that group that I mentioned. So we have the 10 to 20 top VCs in the life science sector. We have the around 15 corporate VCs, maybe including also health insurers. And they should get to know each other, trust each other, and then invest together in startups. So how does that work technically? I don't want to spend too much time on that. I could talk hours about details, but just that everyone understands the idea, why it is attractive to corporates to get into that system. It's not just because they get access to an amazing deal flow. It's also because they get a co-investment. So we have the European Union through the European Commission as an anchor investor that has already committed up to 150 million euro. 75 million euro are already there. And once the deal flow is visible, they put another 75 million on top. It is administered by EIF in the Sustainability Development Umbrella Fund in the EST of Health Compartment, covering around 200 million euro. The 10 to 15 corporate VCs also put in some money already up front. So it's kind of their commitment to really show that they want to be active. So that sums up to the 200 to 250 million euro. That gets as a co-investment into the private VCs, into the selected 15 to 20 European life science VC funds. And then they can team up individually with the corporate investors that you can see on the top, on the far right in this slide. So they team up and invest together. Who is managing that? It is part of my pillar as a director of business creation. I'm overseeing also that activity, and it is implemented together with Jean-Marc Bourrez from our French EIT Health area. So Jean-Marc and I are managing that together, including our regional teams. As you might know, we have offices, and in those European offices, we have business creation managers supporting the startups. In summary, that is a great opportunity for, I would say, almost everyone who is present here, for the startups, for the corporates, also for medical doctors that have an idea and want to make it real, or are looking for innovative ideas. That certainly would be could be found in that VCE program. Just to visualize a bit how we progressed so far and what we did so far. That was in 2019, the first initial EIF collaboration agreement with the former CEO of EIF and the director of mandate management. So we signed together that we would put that in place. And just recently in October, we had an event, a dedicated VCOE event with a keynote from President Macron in Paris, who also announced and welcomed that this instrument would be put in place. So we're more than happy that this will happen. And the 150 million euro anchor investment from the European Commission was also announced in a press release of the Commission at this event. Now I just want to use the last 60 seconds that I still might have for a brief invitation. It's really a coincidence, and it's well timed, dear Dominics, that you put your slots kind of in a way so that they don't overlap too much with our slots of our summit. It already created some confusion when I said I'm speaking at the summit, at the Digital Health Summit. People thought that it would be ours, and when I'm telling people that I will be in the studio next week to host my sessions in the summit, they thought it would still be the Digital Health Summit that is ongoing right now. So things are really very complementary, and it's great synergy. We started with our EIT Health Summit yesterday, talking about artificial intelligence in health. We will talk tomorrow about high value care. And on December 1st, next Tuesday, I will talk about new business models, also in digital health. I will have great examples. I also will have a Harvard Business School professor showing her latest Harvard Business School review and case study that she just released. And on December 3rd, we have my personal highlight over the year. That's our final of the EIT Health Catapult. That's our business plan competition of our top European startups, where we will award 210,000 euro prize money, and in the meantime, 800,000 euro of in-kind prizes, plus a little award that is sponsored by our friends from NASDAQ. So last year, our winners were displayed at the New York Times Square, as you can see here. And, we are looking forward to see that during Christmas also this year. But today we also sponsor a little bit less, but we're also happy to see the winner of today's competition, and will provide a 5,000 euro award. Very much looking forward to that. That is how we celebrated our winners last year. Unfortunately, that won't be possible this year. And also, Dominic, I'm missing the burgers and the beer and the cocktails and drinks that you usually have at the Digital Health Summit. Unfortunately, that's not possible this year, but we certainly will have a lot of fun and a lot of excitement and a lot of engagement. Thank you so much, and I wish you all the best for today, for the next upcoming 2 days, and handing back to Dominic. Thank you.